Okay, so this is the psychological profile of the atopic eczema patient. So basically, this paper talks about the correlation between personality and psychological variables and atopic eczema. So this question has been asked many years by many people, but actual studies are very minimal. A review of some research shows that hostility, anxiety, and hypersensitivity are displayed by atopic eczema patients. However, this article highlights that the fact that it is common in these patients has led many people to assume that these behaviors are directly caused by eczema, which is not always true. One study showed that depression and hostility occurred more often in 32 atopic eczema patients than their control group. Because of the study, they realized that as a result of the restrictions from eczema, these patients had difficulty dealing with interpersonal conflicts so basically it led to these mood problems, mood disorders. So this type of research has not really provided evidence of the significance of psychological factors in atopic eczema, but it does indicate that personality traits are common in these atopic eczema patients. So basically, there's been little interest in exploring these issues further. So this study aimed to confirm that these traits that were previously found in those old studies were still present, because they stated that these studies were over a decade old and no one looked into them further, like I said before. So basically, this study had 40 patients, 23 were female and 17 were male. They were all diagnosed with atopic eczema by a physician. The average age was about almost 26 years, and the age range was about 16 to 45 years old. The majority had suffered for more than 2 years with atopic eczema. And then to conduct the study, they were given each many different questionnaires all about the skin disease. So basically, atopic scored higher on the neuroticism scale, so they were more mentally ill. But they scored no higher on the scale of introversion, or basically being more shy, which didn't support their hypothesis that they had before going into the study. So basically, they scored higher on 4 out of 5 subscales. So they were higher on the urge to act out hostility, self-criticism, and guilt, and so on. So basically, they had a higher overall score of hostility, which supported the previous study that stated the same thing.